Hello Kayla, my name is Bailee and I'm going to be doing a head to toe assessment on you. First I am going to be checking your skin. I'm going to check your nails. Okay, and next I'm going to be inspecting your face, looking for acne or anything like that. Your hair, I'm just going to palpate your scalp. I'm feeling for any bumps. Let me know if I hurt you. Next, I'm going to check your eyes, your conjunctiva. I'm just going to pull down your eyelids and look. Okay, everything is within normal limits. Next, I'm going to check for extraocular movement. This is going to be testing cranial nerve 3, 4, and 6. So if you can just follow my fingers, please. This is like the 6 cardinals of movement, the visual fields. Next, I'm going to be examining your visual fields by confrontation. So if you could please just let me know whenever you see my fingers.
Yeah.
Okay. Next, I'm going to perform the cover and uncover test. You could cover one of your eyes and let me know what number you see. Focus right here.
1, 1, 2, 1, 2, 1, 2.
Okay? And I would do that on the other side. Next, I'm going to examine your pupils. Just getting my pin light here. I'm going to shine this light into your eyes. Okay. Okay. So I'm going to have you follow my fingers in and now out. Okay. Next, I'm going to be performing the rubber test. This is going to be the conduction of your hearing. So I'm going to hit this, and I'm going to place it on your head. When you no longer hear it, please let me know, okay?
No.
Okay. Next, I'm going to be doing the Rhine test. I'm going to put it on the back of this, your mastery process, and then come forward. When you no longer can hear it on this, let me know, and then I will come to your front. I'll do it on this side so that they can see. Next, I'm going to do the whisper test. I'm going to have you plug one ear. Okay, and I'm going to whisper a word into your ear, and I want you to tell me what it is. Okay?
Baseball. Baseball?
Correct. Next, I'm going to check your ear, your auricle. I'm just checking for movement. Is there any tenderness, feeling for warmth of touch, anything like that?
Mm-hmm.
Next, I'm going to just feel your neck. I'm going to check your nose, looking at it visually, and then I'm going to check your turbinates. The light, I'm going to pull your nose up and look in. Okay. Next, I'm going to palpate the frontal and maxillary sinuses. Okay. Next, I'm going to check your lips. Everything doesn't look like anything. There's no dryness of your lips. Can I have you smile? Okay, can you open up your mouth? Okay, stick out your tongue. Go side to side. This is cranial nerve 12. Can you lift up your tongue? Okay, next I'm going to get my light and have you say ah. Okay, say ah. Okay, perfect. Next I'm going to do your cardiopulmonary. I'm going to examine your respirations. I'm looking for expansion, symmetry. Everything looks good. Next, I'm going to check for tactile formitis, and I'm just going to put my palms on here. Okay. I'm going to do the same on the back. If you can please fish. Yep. Perfect. Can you say 999, please?
999.
Again?
999.
Again?
999.
Okay, I'm going to do that again on the front. Say it again. 999.
999. 999. 999. 999.
Okay, now I'm sorry about that. Now I'm going to percuss for your diaphragmatic excursion. If you can take a deep breath in and hold it. Okay, I will mark that there. I'm going to have you go ahead and let your breath out. Take a few normal breaths. Okay, next I'm going to have you take a deep breath in, and then you're going to hold your exhale out. Okay, I have both of those points marked, and next I'm going to measure. Okay, perfect, it is within normal limits. I'm going to auscultate your lungs, so I'm going to listen to your lung sounds. Okay, when my diaphragm touches your back, will you please take a deep breath in and out? Okay, I'm going to also listen to the front, do the same. Okay, now next I'm going to have you say 999, and I'm going to listen.
999, 999, 999, 999.
Okay, next I'm going to assess for any tenderness, so if you could please let me know if you have any tenderness. You're going to feel a little bump. Any tenderness there?
No.
Okay, next I'm going to have you swing your legs around. And I'm going to have you, I forgot to check your pharynx as you say you're off, so I'm going to have you say that one more time. I know I checked the one time, but I want to check your uvula. Okay, and I'm going to go ahead and have you wrinkle your forehead. Okay, can you puff up your cheeks? Okay, now next I'm going to have you clench your teeth, and I'm going to palpate your temporal and masseter muscles. I'm checking cranial nerve 5. Next, I'm going to palpate your neck, your lymph nodes. I'm going to do preauricle, which is in the front, postaurical, occipital, which is behind your neck, submandibular, submental. Okay, next I'm going to do superficial cervical. Okay, I'm going to have you look this way. Oops, sorry.
It's okay.
Deep, post-cervical, and supraclavicular. I'm going to assess your strengths of your shoulder. If you could shrug your shoulders up and down. Okay, now turn your head that way, up and down. Oh, sorry, keep your head that way and shrug your shoulders up and down. This is cranial nerve 11. I'm going to have you go ahead and roll your neck. Perfect. Now I'm going to test your thyroid. And I'm just going to come from behind. I'm going to put my hands right here, and I want you to swallow. Thank you. Okay, now back. Okay, I'm going to have you go ahead and lay back. I'm going to be measuring your jugular vein pressure. Okay, right about there, and I'm going to have my straight edge and hold it out. And then next I'm going to get my centimeter ruler. Measure 1.5, that is within normal limits. Next I'm going to listen to your heart sounds. I'm listening to aortic, pulmonic, herbs, tricuspid, mitral. Okay, now I'm also going to switch it over and listen to it with the bell only. And I'm doing the same. Okay, just going to feel, palpate for that point of maximum impulse. Okay, next I'm going to listen for any carotid relief. First with my diaphragm and then my bell. would do that on the other side as well. Everything is normal. Next, I'm going to check for a femoral pulse. I'm going to assess for any edema in your face, your hands, your ankles. Then, do you mind if I take off your shoes?
That's okay.
And your feet. Next, I'm going to palpate your pulses. All right. I'm going to have you go ahead and lay down. Just going to lift up your shirt. Okay. I am inspecting your abdomen right now. Just looking to make sure there's nothing abnormal. I'm going to listen for your bowel sounds. Sorry, my hands are cold. I'm going to be listening in all 4 quadrants. Okay, this might be a little cold as well. I'll do a light touch. Next, I'm going to listen for any bruise. I'm listening for aortic, now renal, iliac, femoral. I'm going to palpate your abdomen. First is going to be light touch. Sorry, maybe. Okay, now it's going to be a little bit deeper of a touch. Okay, is there any tenderness or anything noted? Okay, I'm going to have you just sit up just a little bit so that I can lay this head down so I don't. Oh, just 1 second. Okay, can you go ahead and lay down? Going to be palpating your liver. So I'm going to press down and go a little bit under your rib cage. Okay. Is there any pain?
Mm-mm.
Okay. Next, I'm going to palpate for your spleen. This is going to be in your left upper quadrant. I do not feel anything, and that is good. Now I'm going to percuss the liver span. I'm going to start from your belly button and go mid-clavicular between your ribs. Okay. About 3 centimeters. That's good. I'm going to go ahead and place your shirt back on. Okay, can you go ahead and sit up? I'm just going to lift this up. Okay. Next, I'm going to do your musculoskeletal. If you could please step off. I'm just going to be assessing your gait, so if you could walk that way and come back. Okay. Okay. Now, next, I'm going to inspect your joints. You can just stay standing. I'm assessing for any warmth or tenderness. Is there any tenderness?
Mm-mm.
And have you go ahead and step back up here. Okay, can you kind of lay back just a little bit? Any tenderness here?
No.
None. Okay, I'm going to have you go ahead and lift your knee up. Any tenderness?
No.
Okay. Tenderness here? Here?
No.
There? No? Okay, go ahead and sit down. All right, next I'm going to check for any passive range of motion. So I'm just going to have you move your shoulder. Out. In. Up. Down. Okay, now your elbow, I'm going to have you go like this. Go up. Down. In. Out. your wrist. Can you just kind of do a circle? I'm gonna have you have your hand like this. Now up and down. Okay. Can you go ahead and twist your ankle or your foot into a circle? Okay. Any tenderness there? None noted? Okay. Now I'm going to test your strengths. You can push against me. Okay. Now pull against me. Okay. Now next I'm going to check your feet. Can you push? Okay. Now pull. Okay. Now next I'm going to have you pull out your elbow like this. Can you push down? Okay. Now up. Okay. And I would do that on the same side. Now can you go ahead and just lay your back like this. I'm going to have you go ahead and push, bend your knee. Okay. Out. Now can you push down? Okay. Now up. Okay. Perfect. Now I'm going to have you stand up. And we're just going to have you kind of tilt like this so we can show. And I'm just going to be feeling and seeing your curvature in, out, and in, and back out, and that's appropriate. Can you go ahead and bend down? And as you bend down, I'm just going to be feeling and checking for any scoliosis, anything different within your spine. Does any of this hurt?
No.
Okay. Can you go ahead and lift up as I'm still feeling? Okay, perfect. Now I'm going to have you go ahead and perform the Romberg test. Can you close your eyes? Okay. Now still closing your eyes, can you place your hands out in front of you? I'm looking for any pronate or drift. Can you flip your hands where your palms are up? I'm assessing for a pronate or drift. Okay, next I'm going to, you can go ahead and open your eyes. I'm going to assess your heel to toe walk. So if you could go like this, please. You can go forward and then come back. Okay, turn around. Okay, perfect. So I'm going to have you go ahead and you can sit back up here. I'm going to check your finger to nose, so if you can close your eyes and set your finger out like this and touch to your nose. I'm sorry. Okay, one more time. Okay, so now I'm going to have you put your hands on your legs, and I want you just to do like this. I'm checking your alternating movement. Okay, and next I'm going to put my feet down here, and I want you to do that with your feet. Just go back and forth, back and forth. Okay, perfect. Now next, I'm going to have you do a perception of light touch or sharp touch. So I'm going to have you close your eyes, and I'm going to place an object on you, and I want you to tell me if it is light or sharp.
Light. Light.
I'll have you move your, okay.
Light. Sharp. Sharp.
Okay, perfect. Okay, I'm going to hit this, and then let me know whenever you know, when you hear the vibration and no longer feel the vibration.
Okay. I feel it. Sorry. No longer feel it.
Okay, I'm going to also,
I feel it. No longer feel it.
okay, I'm going to do the same on your feet.
Feel it. No longer feel it.
Perfect. Now I'm going to go ahead and assess your reflexes. Just stay normal and relax. Okay. Now I'm going to go ahead and do your bicep. Okay. Tricep. Okay. Now I'm going to do your brachioradialis. Now next I'm going to do your patellar. Okay. And now your Achilles. Okay. I have one more that I'd like you to do. I'd like you to please get off the table. I would like you to walk on your heels that way. Okay, now come back. Okay, now I'd like you to walk on your toes that way and come back. Perfect. Do you have any other questions about the assessment we did or anything you don't understand?
No.
Okay, thank you.
Thank you.